Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And our guest today is Mike Mainiero. He's SVP and CDIO of Catholic Health. Welcome, Mike.
Thanks for having me, John.
Yeah, excited for today's discussion. But before we dive into the topic du jour, tell us a little bit about yourself and Catholic Health.
Sure. So I'm the Chief Digital Information Officer, as you said. Catholic Health is in Long Island, New York. We're an 18,000 employee health system, 6 hospitals, several nursing homes, dozens of ambulatory locations. I oversee all aspects of technology. That's the electronic health record system, digital, cybersecurity, everything that falls under technology in a health system.
Awesome. Well, we want to talk about the CrowdStrike incident and kind of your response, lessons learned. And to be frank, it could be any company that this is going to happen with. We just saw in the news Microsoft updated a patch and HP PCs had basically the same kind of incidents, right? So, this is a really important topic, talking about updates and how do you approach them. But how did your team respond to the CrowdStrike incident?
I think a couple of things. First, it came in the middle of the night, which was good and bad, right? Good for operations, bad for getting us up in the middle of the night. I think, and a couple of themes here is, we had a learning and instrumentation. There were symptoms with this particular incident because it was so widespread. Some of the symptoms we didn't even know they were related. So we had people traveling. As you know, airlines were affected. Some of our third-party vendors were the early canaries in the coal mines. And, when you start to see a pattern and more than 1 or 2 outages, your cybersecurity and, your spidey senses sort of kick in and there's a problem. But this particular incident, we found out around 1 in the morning. And how we responded, we have this alerting system called PagerDuty. And basically, it's like a send word now, or a system that once it's invoked, it texts pages and gets you out of bed. So I was woken up out of bed. We rapidly get on a call, and we identify, this could be anything. This could be cyber, it could be an update, it could be power outage, whatever it may be. We need to identify, assess, triage, mitigate, and communicate, sort of at all the same time.
Yeah, that's a good framework for doing it. And ironically, one of the guests we had on the CIO podcast retired because he was tired of waking up at 1 a.m. But you can't predict it, right?
It goes with the territory, right?
And that's actually when updates happen. So I guess it's pretty common, for that to happen. But how quickly did you realize what was happening and that this was this larger scale problem? I think that's, it's interesting. You talk about the spidey senses as well. Like,
Yeah.
I think the spidey senses are like, oh, is there a breach?
Well, yeah, I mean, that's your
happening.
initial. Yeah, I mean, so that's funny you said that. With this, typically, if you have instrumentation, and for listeners, that to me is just if you have the right control panel set up. So if I'm driving a cruise ship, I can see, the control panel of everything that's happening. If you have the right instrumentation, you can usually point to a smoking gun. It's this particular interface, it's this particular system. With this, it was a little ambiguous at first because, we were seeing cloud systems going down, and we actually thought initially it was a Microsoft issue. So I felt bad for Microsoft, after the fact, because everyone was pointing the finger at that.
I mean, it has the blue screen of death. So
yeah, so that was your smoking gun. And one thing that, I think CrowdStrike's in this case is an amazing company. We have a great partnership with them. They have a great culture of engineering. They let us know right away. So my initial reaction was, oh boy, what's happening? Is this cyber? So you come in 2 in the morning, I shuffle downstairs, try not to wake up any kids. And once I get on the screen, I get a status report from my CTO, who's very much on top of things. And, that ready state, really important. So we have this way of talking on that call. Okay, what's happening? What is it? And we were, I think to your question, we knew it was CrowdStrike. We knew that was the particular update. There's been many outages. Actually, Microsoft did an update about a year ago. We didn't know it was coming. I think it was for OneDrive or something like that. We identified that as a cyber incident and had a false alarm. So this happens every week. Not this scale, but every week there's a system or a third party that goes down. Depending on your level of severity, this is a severity 1, then I get involved. The CIO, CDO gets involved, but there's incidents, I think, on a weekly basis. So to that point, we were able to identify it pretty quickly that it was CrowdStrike, and we had intel that it was this particular fix. This is how we need to remediate.
Interesting. So talk to me about what were some of the things you've done or you had done to prepare for something like this? And are there some lessons for you and your team going forward that, to help, to all the points, identify, mitigate, and then fix,
Yeah.
the
I
problem?
think first and foremost, I kind of have this philosophy: you're either getting better or worse. You're not staying the same. So
Mm,
if you're not doing retrospective sort of Kaizen with everything that happens and paying it forward, you're not going to succeed. So we, especially in healthcare, right? So in healthcare, when there are problems, that's going to affect the emergency rooms. That can affect communications. That can affect the ability for a physician to read a stroke image. That could affect surgery. So you have to be able to have a well-oiled engine, I think, as I said earlier, to identify, communicate, respond. So as far as lessons learned goes and what we have in place, I would say the fundamentals are a very strong monitoring and alert system to get people to muster, right? So, I'd say one of the lessons learned just on that point was we do need some more cell phones. So mandating cell phones, I think, 10 or 15 years ago, people would complain, oh, if you send me a text, it's not my job. Or, back when people used to have to pay for coverage. Now I'd say if you're in a clinical or operational capacity from a business delivery perspective, we need to be able to text you. So that's important. Having the alerting system, I think, is the first thing. The second thing is the ability to have the right people on call, right? So I
mm,
think you can always say, I'm available, but this was also during the summer. So making sure that every team always has on call, that's just part of the run book. If you're going on vacation, you have a person who's on call, and these alerting systems typically take care of that. You can actually put the number 2, number 3, number 4. So if it calls Johnny and Johnny doesn't answer in 10 minutes, it goes to Susie, so on and so forth. So that on-call discipline is important. And then that makes it so that you can identify the problem, and you want the entire leadership team to muster, because sometimes I think your earlier question is you don't know what it is, and you don't know what peripheral systems or collateral damage there might be. And so we muster initially with a very large amount of people, then I start dismissing people. I think the third thing is having strong operational connections, so that, especially in the healthcare setting, we've got 6 hospitals. We have great operations teams. Our COOs and presidents were all involved in the early hours in the morning, 2 or 3 in the morning. They're listening. They're ready to help us identify where we need to mitigate. Check out these are areas where we've got surgeries happening in the middle of the night. You need to go to these stations here. Otherwise, we're just going to go in and try and fix it to the best of our ability. So that communication with the business has to be established. And I think the last piece, I mean, there's a lot you could do here, is you have to do fire drills, just like, back in the day in school, doing fire drills. If you don't do fire drills, it's interesting. I read a book on some extreme survival book, and one of the pilots it was a section on pilots, and he said, if you're flying a pilot and taking off from an aircraft carrier, your IQ drops like 50 points. So you have to have the rote memory and run books. You have to do training, discipline, all of that. So same scenario applies. When this happens, you don't want to be figuring out what to do. You need to have a run book, and you need to have run through that. So that's, I think, the big takeaway is making sure all parties know how to run through these type of scenarios.
yeah. No, I think communication was at the core of the recovery for this incident. But you're right. I mean, what do they say? The backup's only as good as whether it can be restored. And if you haven't tried to restore it, you have no idea.
And that's the fear. Thankfully this wasn't a cyber incident, but you're looking at, ransomware, compromised data, and, the time to get back, for the sophisticated IT departments, you're looking at your disaster recovery what's our time to live? What are our tier one systems that we need to get up in under an hour so we can have business continuity? In this case, it's going to be, our electronic health record system. In this case, the EHR was up, but access to it was not. So if you're a clinician, now intermittent, right? So it wasn't all machines that took the update, but if you're a physician rounding, you can't get on the computer to write a diagnosis or create an order for the patient or medication. So that's pretty serious. And the ability to have that happen real time is very important.
Yeah. Well, and I think it's interesting, and the core to this problem and this question was that it wasn't a ransomware incident. It was an update.
Yeah.
And we've been almost trained, I'm a tech guy by background, right? I'm a tech
Yeah.
guy on Twitter, right? Like you were trained, you got to get the updates or you're going to be insecure, right?
Yeah.
And so we were like,
Yeah.
push the update, push the update, push the update, because otherwise we could have a ransomware incident or security incident. But with hundreds or many of them thousands of systems in your organization, you can't test any and every update because they're coming all the time. So how are you approaching kind of future updates to try and prevent issues like this from happening again?
It's such a good question, because what you're kind of saying, it's a double-edged sword, right?
Mhm.
So, especially in medical devices, right? So, I think the FTC now requires it to be, or FCC, sorry, requires that ability to update remotely. So you want those third parties to be able to patch. You don't want the 0 day. So for the listeners, the 0 day is basically a bug in the software that, unless you patch it, it's completely exploitable. Remember the Citrix bleed last year, issue. So you want that third party to be able to update it. So then what can we do? And I think, when you look at the thousands of systems that you have in a health system, it can be, the variables are almost infinite, right? Some of there's interoperability, so you can't possibly, as a human or a team, be watching all of this. It's like, I think about like, I was a lifeguard in, my younger years, and you're looking at the water. How many people can you watch at the same time, right? How many guards you need? It's impossible as a human to be able to look at this. So what do you do? So I think the drills are important, but when you look at upstream, the contracting, so you can't penalize the companies or put insurance clauses that are so onerous that you can't do business with them. Or in this case, you don't want to put a great company like CrowdStrike out of business either. So then you get into change management and release management. This particular incident, in my mind, because of the nature of antivirus software, it's so, in our case, we couldn't, in order to mitigate, you had to run through this whole script process, but we had to get a secure key. So I couldn't just send this out. I couldn't do a mass push to my infrastructure and just update everything. I had to have people who had some training physically go to those different devices. So I had a whole team come in. We had to give them an hour training, and they drove all around Long Island to do this. So I think, what can we do is the question. So I think my philosophy is, I don't, I try and have great relationships with the vendors, so that, in this case, we do have a great relationship, really important contact with them. The ability to have contact with your account rep or someone very senior to get the intel and mitigate. So that's what we can do. I expect this to happen at this point. I expect system outages. They happen, these major system outages, you talk to any healthcare CIO, 5 or 6 times a year, you're dealing with this. It could be the network, it could be a hurricane, it could, whatever it may be. So, what can you do? I think that resiliency is key. What's your time to bring everything back online, and how well are you equipped to go into sort of command and control mode and mitigate as quickly as possible? And I think organizations that struggle might not have that in place, or they're chasing down Johnny or Susie who need to do the update or have the security key. You got to have that in place. So I think really what I'm saying is have that sort of fireman mentality, the ready state. It's going to go off. It's going to happen. We're going into a holiday weekend. It's going to be Labor Day weekend. There's been many holidays where it happens, and Cyber terrorism typically happens on holidays. They like to snoop around on those days especially. So, we go in with a ready state. I check, make sure that I've got the on-call coverage. But I think to your question, instrumentation is key. So if you don't have the analytic capabilities to detect when things are up and down, you've got hours. I'm sorry, you can waste precious hours or minutes in mustering, identifying, and resolving. So I think just having everything I talked about in place is key. I can't go through each vendor and say you can't update, or you have to do X, Y, and Z.
Well, that would just open
Yeah,
up other risks, right? I mean,
that's right.
I think that's the challenge with the CrowdStrike incident was it was a low level
Yeah,
software that was needed for security. And like, imagine us doing a podcast a year ago and saying, "Oh, are you not going to install your security infrastructure on a device?" Like, you would be like, "Wait, why would I leave it without that?" Right? So
yeah,
you wanted to install it on all the devices because of other risks that it prevented, right? So I think this is the eternal challenge I think that we're going to be facing. So I think having a ready state makes a lot of sense. I'd love to hear more about how you approach kind of balancing the technical fix and going out there to each of those computers to get it fixed. And, along with ongoing patient care, it sounds like the communication was the key there and
yeah.
having them on board. But that's easier said than done, right? And maybe the other solution's giving all the doctors a cell phone to get into Epic, as another layer of redundancy, right? Although,
Yeah.
you can only get so much done through the mobile. But anyway, that's a different discussion.
Yeah, I mean, it's interesting. My 85-year-old mother called me up and asked me if I was affected by this and said, "Why can't you just are there virtual machines where you could?" So everyone has a solution, right? So I think what can we be doing better here? And how did we? I guess to your question about the balance for us, the balance really came to the ability to triage, and just like an emergency department,
Yeah.
where is it most important? We were able to mitigate this by, I think, 5 o'clock the next day. Really the goal is to not have canceled appointments, right? You've got people waiting weeks sometimes for an appointment. We're at our core, patient experience, quality, safety, that's our core, right? So we don't want surgeries canceled, especially non-elective, right? The ones that you don't have a choice, you have to go in, maybe you're coming through the ED. So that's where you're going to triage and muster. So we're going to put all our focus on this. Luckily, this fix wasn't onerous. It took a couple of minutes to get the fix in place. If this had been more onerous and difficult to get online, we would have had a different conversation.
Mm.
To your point about the antivirus being low level, we are asking ourselves questions. What's our deployment and sort of VM, virtual machine strategy going forward for this? But I think to your question about balance, we did a triage where we separated by mission critical, and then there was some longer tail, like people who work remotely. They wound up coming in, the next day. Some people are on vacation. They can come into our local facilities, and we had agents there to help them get updated. But that's not high priority. It's the
Sure.
places where we needed to really make sure we didn't, patient care can still continue, really is the point.
Yeah. Well, it's a topic that's not going to end, as you said. It's coming, and in many ways it was better than the ransomware where your EHR goes down for weeks and months at a time, which we've had happen as well. So, all in perspective, I guess.
I think the average time is 14 days for a cyber outage. So, and then you start diverting patients to other hospitals.
Yeah.
Not a great scenario.
Yeah. Let alone the hospital that burned down. That was another
Oh,
crazy
yeah.
incident. You
Yeah.
never know. Well, we always like to wrap these CIO podcasts up with a little career advice and kind of shift gears. What would you say is maybe the best piece of advice you've been given in your career?
You know, I actually did a leadership course, and I got kind of into Marcus Aurelius's book
Okay.
on meditations. And he was a Stoic. He was also, I think, a warrior. He was an emperor. But there's a quote in there. It's interesting because it's resonated throughout the years in different ways for me. His quote is, "You have the power over your mind, not outside events." and, realize this and you will find strength. So, I apply this in several different ways. I'm human. So, I could also, you can feel your sort of reptilian brain kicking in certain cases, and you can get angry with somebody or you can react. But I think especially in cases like this, you have to keep your cool and realize that how you convey yourself and how you react is just as important as what you do. So I take that, and honestly, I find that when I apply that method of just being, everything works better around me. People react differently to me. In this case, having a certain tone and method and saying, "Hey, folks, this is happening." Not fretting about, "Oh God, the system's down."
The sky
That's
is
not really
falling. The sky
important.
is
I can't.
falling.
Yeah, I can't control that. But what it does is it gets people kind of inspired in these kind of scenarios to really work overboard. I think some people get excited, start yelling at people. They're not going to go. I had people driving, 20, 30 miles to mitigate this. I had volunteer people working, from 1 a.m, and we had to patch all our servers as well, of course, from
Sure.
1 a.m till 5, round the clock, so to that end, I think you can apply that not just to these scenarios, but all of your interactions that you have. So I just find that sort of stoic philosophy, and there's many teachings in this, but that particular piece of advice stuck with me.
Wow. I love that. Most philosophical answer I've gotten, and it was really beautiful. I think we can all take something from that in controlling our brain, and what can we control, what can't we? Interesting.
Yeah.
Love it. Well, Mike, I appreciate you taking time to talk with us and share your experience and insights on a very important situation and how you responded to it. I'm really impressed with your response, and I'm sure your team felt it as well. So appreciate you taking time to talk with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Mike.
Thanks, John. Thanks for having me.